We are about 5 weeks away from the start of the new school year. That means it is time right now to really start thinking about getting your children up to date with their vaccinations because time is running out. On your screen are the vaccines that are required for children in city schools. Some of those are dependent on how old your child is. Research shows that vaccination rates have actually declined across the country in recent years. That has led to a reemergence of diseases like measles and whooping cough that were once less common. For more on what parents and families and children need to know, we're joined by Dr. Shivali Choxi. She's a pediatrician with the city's health and hospital system. Great to have you with us today. We do appreciate that time of the year. So again, the types of vaccination that your child will receive, must receive, really depends on their age. But all school kids as young as several months old up to 18 years old do need to have their vaccinations updated. So what should parents be thinking about right now as we head into that first day of school?
Absolutely, yeah. I think back to school season is one of the best times for parents to really check in with their pediatrician, not only to review their child's overall health, their growth and their development, but make sure that they are up to date on their recommended immunizations. And this is important, obviously, because vaccines help to prevent serious disease, but they can protect not just the child that's vaccinated, but everyone around them, their classmates, their teachers, and even more vulnerable family members that may be living in the home. This could be anyone from a new baby sibling to an older grandparent. It's really how we can help to keep our communities, our families, our schools healthy and safe.
Our rules, of course, are mandated by the state health department, but we're getting different types of messaging at a federal level when it comes to vaccines in general. We've seen vaccination rates decline. We've seen a lot of questions from parents across the country, perhaps even here. What are you hearing and seeing among parents who may have some concerns and questions about vaccines?
This is a great question. I really feel for parents today. As a parent myself of a 2-year-old, I think we are navigating more information than at an unprecedented rate. And some of that information is rooted in the science and backed by the evidence and the medical community, and some of it isn't. And it can be genuinely difficult to tell the difference. But this is really what the research consistently shows. Vaccines are safe, they are effective, and parents overwhelmingly say that their pediatrician is their #1 most trusted source for information and guidance on vaccines. So I really encourage parents to lean into that special relationship with their child's doctor, someone who may have even known their child since the day they were born.
Yeah.
Ask questions, share your concerns, and get real answers. I think working in partnership with your pediatrician is really one of the best ways for parents to really feel confident that they are making the best, most well-informed decisions for their child's health and safety.
Talk to us about some of the exemptions. No religious exemptions allowed. Some parents do bring up a religious issue to not get their children vaccinated. Right now, it's just medical issues. What does that really mean? So when will a child be allowed in school without being vaccinated?
Yeah, this is a great question. Medical exemptions really means there is a true medical contraindication to getting a vaccine. So that means something from a severe allergic reaction, anaphylaxis, or something medical in their past medical history that really prohibits them from getting vaccines safely. Those are really the only exemptions.
And if parents have questions about whether or not their children are up to date, they should be getting some kind of notification from the schools. How does that work?
Yeah, sometimes the schools will let parents know, but really the best way for parents to know if their child is up to date is really just to, again, schedule that appointment with their pediatrician, check in. The pediatrician can review their child's record and really recommend the vaccines that that child is due for.
In our final moments here, you're going to have those parents who are concerned about the vaccines, have questions about them, may not want to get updated vaccines. In our final moments here, what else do you want to say to them if they have some questions and concerns?
Yeah, I think I'll just reiterate that they should continue to ask those questions. That's what we're here for. No question is off limits for us. We really want to help parents understand why vaccines are important, how they can help protect their child, and why they really help to keep our children healthy.
And questions are good, right? You should get the information, the updated information, for
Absolutely.
sure. Dr. Shivali Choxi, it's great to have you with us. Thank you so much for being with us.
Thank you so much for having me.